Welcome everyone to our live Healthy Living event, Pediatric Recurrent Fevers, Beyond the Basics. We've all been there as parents. Your child has a fever, what do? Do you call the doctor, head to urgent care, or the ED? Rest easy because we're getting answers from a pediatric expert. Today, Pediatric Infectious Diseases expert and pediatric hospitalist Dr. Yaseen Rafe'e is joining us. After a residency at St. John Hospital in Detroit, Dr. Rafe'e completed a fellowship in pediatric infectious diseases. He has been the director of pediatric infectious diseases at Hurley since 2011 and an assistant professor at MSU. Best of all, you can ask Dr. Rafe'e any of your questions right here live, right now. All you have to do is text me. Text, don't call, at 248-935-2562. You could also post your questions on Facebook or YouTube. Let's get right to that valuable information you're here for. Dr. Rafe'e?
Hi, good afternoon. Thank you for the introduction. It's my pleasure to be here today and talk about this important topic. It's a common reason why parents get to worry, bring their kids to their doctors or even bring them to the hospital. So it's my pleasure to talk about this topic. We will try to address today a few issues here. We'll try to help you understand what causes fever, what is the definition of fever, what common triggers, how to measure it, where to measure it, and when to call your doctor or your nurse, and when to worry and when not to worry about it. I'll start with little information here about what we call it the normal thermostat of our body. It's this small body part inside the middle of the brain where you could see the red arrow. We call it hypothalamus. This is the center that's responsible of regulating our body's temperature. It's really like a thermostat. It really regulates the temperature within tight margin, anything between 97 to 100 Fahrenheit. So all of us has this normal body's temperature fluctuations, and that center is responsible to maintain that temperature within these boundaries. Sometimes the temperature could be a little bit higher in the evening compared to the morning. That's normal, that's physiologic. More energy toward the evening, more metabolism might be responsible for this. Actually, women in their second half of their period might have a little bit higher temperature baseline compared to the first half. All of this is regulated tightly by this center. Now, again, how to measure the temperature? You could see here that there is these two simple devices. The blue one is a digital electronic thermometer, and the other one is the old glass mercury thermometer. I usually prefer one of these two. And personally, I prefer the electronic digital one. It's much faster, it's accurate, and it's safer. And usually we use these two types of thermometer to measure the temperature. And I'll talk in the next slide about where and when to measure the temperature. But the best location to measure the temperature overall is the rectal temperature. It really represents what we call it a core body temperature. And now there is a slight variation between temperature measured in the rectum when you compare it to measuring the temperature in the under the armpit, sometimes also in the oral. And I will talk when to measure it in the rectum and when it's okay just to get an oral temperature or under the arm temperature. First of all, I get a lot of questions, a lot of concern from the parents about what is considered a real temperature. So for us, temperature is defined anytime your body temperature measured rectally when it is above 100.4 Fahrenheit or 38 Celsius. So this is by when you measure the temperature rectally. Now some parents, because they already heard about the temperature might be a little bit lower when you check it under the tongue or the armpit, they automatically add 1 or 2 Fahrenheit degree and kind of calculate the temperature based on that. Personally, I prefer the parent just to report what is the temperature they measured and how they measure it. and then leave it up to the physician to decide if it's appropriate for that child to do rectal temperature or just move on and do any workup or testing based on the reported temperature of the parent. But generally speaking, when you bring especially the young child, the newborn, to our emergency room or to the doctor's office and the child looks sick, if we wanted to get an accurate temperature, we do a rectal temperature. Now, there are different methods of measuring the temperature, as you could see in this graph. Under the tongue, there is this ear thermometer, there is this forehead gun kind of thermometer, and there is under the armpit. Generally speaking, many of these devices are easy to use, and you could see them being used even in hospital ERs, doctors' offices. But really, the best and simplest way, and actually the most accurate way, where there is a lot of information, a lot of experience, is to check the temperature in the rectum. If that's not possible, it's under the tongue for the older child or under the armpit for the young infant and toddler. And this is a graph that shows how to, safely to do the rectal measurement, where you put that young infant in your lap and use that digital electronic thermometer and insert that metal part or metal tip of it just around 5 millimeter to 10 millimeter inside the anal opening, and leave it there for half minute to 1 minute. And once it beeps, that's the temperature, and that's accurate, good temperature. And usually this is practical to do in young infant, especially in newborns and young infant. And actually this is the best way to do it for that age group, because this is the age group where fevers is important to detect, and many times we do a lot of testing in that age group because they can get sick easily and quickly. So having accurate measurement is encouraged in that age group, and that kind of it's at the time where I would really want a rectal temperature to be measured. It's easy to do. You can ask a pediatrician, a nurse in the office of your pediatrician, to demonstrate that to you. Now, once you document there is a temperature or the child is sick, you don't need to keep checking the temperature in the rectum every time. You could check it, in the armpit for that young infant, because you already documented that, and little variation doesn't matter at that time because you documented temperature, you called your pediatrician, and you started to act on it. So I won't encourage that every time you do the rectal temperature, and definitely I don't encourage the parents to do rectal temperature if the child is immunocompromised. Let's say, for example, somebody is on chemotherapy, has cancer, or has neutropenia, which is a special white cells that is low in the blood. So if your child has any of these conditions, actually it's contraindicated to insert that rectal thermometer in their anal opening. So that few cases where I won't do a rectal temperature. Other acceptable way to do and check the temperature is under the tongue, or oral temperature. And that's definitely completely acceptable and good way to measure the temperature for the older children who can understand and follow instructions, typically age 4, 5 and older. And the accurate way to measure that temperature is, first of all, make sure that you do it 30 minutes at least after the child ate or drank anything cold or hot, because that can affect the temperature inside the mouth of the child and can falsely affect the reading. So half hour after your child ate or drank anything, you get that digital thermometer, and you wash it, you rinse it, make sure it's clean, and then you put it under the tongue. You put the tip of the thermometer under the tongue and ask the child to hold to the thermometer using the lips, not their tongue, not to bite on it, just seal their lips around the thermometer and leave it there for half minute to 1 minute till it beeps, and then that you got a good oral temperature. Now, I want to mention here that one advantage of those digital electronic thermometer over the old style glass mercury thermometer, that it takes much shorter time to beep or measure the temperature than the old glass mercury thermometer. So you could imagine, a child holding that thermometer for 3 minutes to get a reading versus like 1 minute when you do that digital electronic one. Now, I want to emphasize, I already talked about, what is considered a temperature, which is anything above 100.4. And I emphasized, how to measure it and when to measure it. But I want to share with you what we call it clinical wisdom, that really sometimes it doesn't matter how high the temperature. It really what matters most is how is the child behaving. You could have a low-grade temperature, 100, 101, and the child acts sick, lethargic, having trouble breathing, don't want to eat, vomiting. That will be more concerning than a child who has a temperature of 104, let's say, and acting well, running around, eating, playful. You give a Tylenol, and half hour the child is running around. I will be more concerned with the first scenario than the second scenario. Just want to mention that because it's really, generally speaking, also, and I will talk about that in this slide. Fever is a normal body's response. It's the way your body naturally evolved to fight infections. There are a lot of theories about, is it harmful to have that much of temperature? Is it beneficial? But one theory is that raising the body's temperature might inhibit the bacterial replication in the body, and that benefit the immune system and help fight the infection. Now there are different reasons how why you could have a fever, different triggers. It could be a bacteria, it could be a virus, it could be sometimes a drug, like a little chemical, some autoimmune disease where your immune system starts to misfire and produce a lot of what we call them cytokines, or you could call them chemicals in the blood that circulate in the blood. You could see here a cascade of what we call inflammatory markers and inflammatory cascade, where it can be triggered by any kind of external bacteria, virus, or sometimes even internal antibodies. And that cascade circulate in the blood and reach that thermostat center in the brain, which has mechanism to regulate the body's temperature, causing you to have fevers, chills, shivering through different methods. So at the end, this is a normal physiologic body response. And most of the time, it's not harmful by itself. We worry more about what's causing the fever than the fever itself. In rare occasion, fever can be harmful, especially if it's caused by external heat, for example, like heat stroke. Or sometimes when it is really high, 105, 106, and the child, let's say, have susceptibility to have febrile seizure. We'll talk about that later on. But outside these few examples, fever by itself is not harmful. Of course, we need to treat it because it makes the child more comfortable, eat, drink better. We need to treat it, meaning we need to understand what's causing the fever, so we need to take the child to the doctor. We'll talk about what, the reasons when you take the child to the doctor or call the nurse. But generally speaking, fever by itself is not harmful. Now, one way for us as physicians to diagnose what's causing the fever, because that's our next focus. We treat the fever, we make the child comfortable, but then the most important question here is what's causing it. So for us to kind of figure out what's causing the fever, which is a huge list of different infections and autoimmune diseases and medication sometimes, it's important for us to classify the fever. What kind of fever we're dealing with, what pattern of fever we're dealing with. Sometimes the focus or the reason for the fever is so obvious, and we call that fever with a focus. A child comes with a fever and apparently already have a sore throat, has a cough, has an exposure to somebody with flu, so we know, okay, this is a fever with a focus, and it's flu, and many times you don't need to do any more testing, or you may do few testing, and you just treat the reason or reassure the parent. And other times, the fever, source of the fever or the focus of the fever is not known. We call it fever without a focus. So the child just have fever and nothing else. In that situation, we classify that further into fever without localizing signs, meaning the child has this fever only for like 1 or 2 days. Or if this fever has been there for significant amount of time, let's say 6-7 days or more, we call that fever of unknown origin. And that's important for us because different illnesses causes different type of fevers and different patterns of fever. And that's why it's important that parents keep a chart, keep a log of their temperature, of the child temperature, how it's measured, and what time it's measured, and the day where it's measured. Even the days when the fever is not there, it's important to keep track of that, because that really definitely gives us a clue to a lot of illnesses and save us a lot of like unnecessary testing sometimes, X-ray imaging, because that could be very informative. There's another graph here that you could see show different type also of fevers during each episode of fever. So you could have intermittent fever where the fever fluctuate between high and normal. You could have also what we call it remittent fever, where the fever is always high, but it fluctuates, but it's always high. Or you could have persistent fever, the third graph on the bottom, where the fever is steadily high, not fluctuating for a few days and then goes away for a few days. In this next slide, I want to talk a little bit more about fever of unknown origin, which is a common reason why I see kids in my office or sometimes even come to our emergency room if they are sick. Because many times when the fever is there for 1 or 2, 3 days, you call your pediatrician. Pediatrician will be able to guide you and help you treating that initial few days of fever and figuring out what's causing the fever. But many times when the fever linger for more than that, as I said, 7 days or more, and the initial testing don't reveal what's causing the fever, that's a common reason why the kids could come to our office, our clinic, or even if they're sick, might come to our emergency room, or even their pediatrician might refer them to be admitted directly to Hurley to do further investigation and further testing. I want to mention here quickly in this slide about when to call your nurse or your doctor's office. To make it simple, I had those few bullets there. Basically, any baby younger than 3 months with a rectal temperature of 100.4, you need to call the pediatrician office. It's very important that this age group, this young age group, that those babies get seen right away. And many times your pediatrician will direct you to come to the emergency room because those babies can get sick easily and quickly. And many times you really need to do testing on most of those babies because you cannot identify where the fever is coming from without testing because they're just young. The other reason to call a doctor is if the baby is between 3 and 6 months and has that temperature for 2 or 3 days or more. So basically older infant, anyone older than 3 months, if they have a fever of 100.4 or more and they're acting good otherwise, you could wait on it 1 or 2 days. But if it linger or lasts more than 2 days, that's where you're gonna call the pediatrician office and ask or bring the child to be seen. Of course, the third bullet here talk about you need to go and take your child right away to the emergency room if the child seems sick, fussy, refuses to eat or drink, or having difficulty breathing, regardless of the temperature, regardless of the age. And I emphasized that point in previous slide. But we'll keep going here. What about older kids? As I said, older kids can have a temperature for 1 or 2 days, and as far as it is low grade at anything between 100.4 and 102, we're okay. You could treat that with proper doses of Tylenol and Motrin and ensure they're hydrated well. But if fever lingered more than that, you call the pediatrician office. Now, what about higher grade fever, like anything above 102? Call the pediatrician office, regardless if it's there for 1 or 2 days. That's a high grade temperature. Anything above 102 might signify something more serious. And take the child to the urgent care, and the pediatrician will advise you about the next step. Of course, if the child had a seizure with the fever, which is something that we see commonly happen in kids younger than 5 years of age, that's a reason to bring the child right away to the emergency room or call your doctor. Many children in that age group have what we call it febrile seizure. Usually they're simple, benign, self-limiting, doesn't cause any brain damage, but we need to see them because in rare occasion that child with the fever and the seizure could have something more serious like meningitis. So despite overall it's benign, but there is no way to tell unless the child gets examined. Other good reason to take the child right away to the doctors or call the doctors is if the child has a fever and a rash. Or if the child has any underlying medical condition. So as I said earlier, if the child has low-grade fever and look well, you could wait 1 or 2 days before calling the pediatrician. But if your child has underlying health issues, like such as cancer, on chemotherapy, on medication that kind of change their immune system, or have underlying heart condition, has foreign bodies like implanted in them, like a catheter, or have some neurological issues, then regardless of the duration of the fever or the grade of the fever, you need to call your pediatrician. Back to fever of unknown origin, here just 2 more slides. As I said, the definition is there, 100.4 or more Fahrenheit. It's a common reason for referral for many kids. And we were able recently to find the reason for this fever when we compare to the old days. Half of those kids went undiagnosed, meaning the fever will last for 1 week, 2 weeks and resolve, and many times we don't know what's the reason for it. But nowadays we have a lot of diagnostics, PCR testing, swabs, that we can identify the reason for this lingering fever in 90% of the time. And many times it's mainly infection. That's the most common reason why someone might have some sort of fever that lingering that time. It could be a virus, most commonly, mono illness. Sometimes it could be UTI. Sometimes it could be other rare infection that might need more testing to be able to identify it. Now, I'm not gonna talk a lot about this long list, but that can tell you about the many reasons why a child might have fever of unknown origin. And quickly you could see it could be infection, bacteria, viruses, other things like fungus. It could be non-infection like autoimmune, rarely cancers, some other medication can be inducing this. So just to give you an idea how comprehensive sometimes the workup has to be able to pick up what's going on with that child who's having fever for that long time. And always, evaluation of these children with such fever start with good history and good exam. Because really most of the time, 90% of the time, we'll be able to kind of guide our diagnostic testing and treatment based on what we get from the history and based what we get from the exam. But many times we really have to do some testing. That could be blood testing, urine testing, x-rays, imaging, echoes. It all depends on what the child is complaining of and what the exam is showing. And this is different ways of different images that we can do here. Sometimes we may have to do an MRI, which is taking picture of a particular body part, the bone or the chest or even the brain, to see if there is any underlying infection or abscess hidden somewhere. Sometimes we need to do echo to look at the heart. Simple x-ray sometimes can reveal some helpful information. But overall, the prognosis is good. What I mean by that overwhelming majority of kids, after all the diagnostic testing, end up having benign etiology, something treatable or something resolved on its own. This is in contrast to adults that sometimes when they have fever for a long time usually might indicate they have something more serious. But for children, majority of the time, the prognosis is so good. Nevertheless, workup is needed because we can, from time to time, pick up on some situation like where there's an autoimmune disease or a rheumatological disorder. So it's very important those kids get to be worked up. And I'll stop right here and see if anyone has any questions.
Thank you, Dr. Rafe'e. As a parent, it's great to have this information straight from the doctor so you are confident when your child has a recurrent fever. If you have any questions, this is the time to ask. All you have to do is text me at 248-935-2562. You can also post your questions on Facebook or YouTube. Okay, doctor, the first question is, what age should you switch from rectal to oral thermometers?
So usually, in my experience, it's age around 4 to 5 years because that's where the age most children will be able to follow the instruction, hold the thermometer. So it depends on your child at the end. Some kids as young as 3, they'll be able to follow instructions and hold the thermometer and seal the lips around it and get a good temperature. Other kids might need to wait a little bit more. Now, as I said, the rectal temperature is very important for those younger than 3 months. Now, older babies, somebody, let's say, between 3 months and 3 years of age, you could do under the armpit temperature, which is also safe, good, accurate way to check the temperature and report that to the physician.
Tanisha is asking, when is the best time to administer a medication regime, in the beginning or middle of the fever?
So once you identify there is a fever, you measure it and it is above 100.4, there's no need to wait, just give it. You don't need to wait till it's like 102, 103. Actually, the earlier you give it, the better, because the medication by itself might take half hour or 1 hour to work. So give it the minute you are able to measure it and identify that there is a fever.
Let's see, this says, I've always been told you should rotate Motrin and Tylenol for a child's fever. Is that the best course?
Good question. We get this a lot. So generally speaking, I prefer that parents stick with one fever medicine. Usually I prefer Tylenol. And usually it's given every 4 to 6 hours at appropriate doses. Now sometimes we ask parents to alternate in cases where the temperature rises before you can give the next dose. So you cannot give Tylenol every 2 hours or every 3 hours. You really have to wait that period to be able to give the medicine safe. So in that situation, I tell my parents, you can give that Motrin dose if you cannot give Tylenol. So you could alternate in that situation to stick to the proper dosing and the proper intervals. Otherwise, you can be overdosing the child. So I think the idea behind alternating Tylenol and Motrin stems from that you don't want to overdose Tylenol or you don't want to give too much Motrin. But there is no real benefit, no evidence that the combination will work better than each one alone. So I prefer you stick with either Tylenol or Motrin. Tylenol have a little bit more safety profile than Motrin or ibuprofen or Advil. I want to also remind you guys that Motrin or Advil, generally speaking, we don't give it to children or infant younger than 6 months. So for that young infant, Tylenol is your only choice. And if you're going to give Motrin, sometimes we allow it one time, but usually it has to be allowed by the physician.
Okay, I'm going to combine these next two. Emma, a new mom, says her mom insisted on bundling her baby up to break the fever, but it seemed to make it worse. What's the best way to treat a fever at home for a baby? And then on the flip side of that, Gail's asking if it's safe to put her child in a cool bath to treat a fever.
Oh, good question too. So I hope I understood the first question right. Bundling the baby to treat the fever, usually, generally speaking, baby should be in comfortable clothing. And usually my recommendation about what is considered proper clothing for a baby is the following. I usually tell the parent that whatever you're comfortable wearing in your house, you just add one extra layer, and that should be good enough to be normal clothing for that baby. That will not result in overheating the baby or making the baby also or exposing the baby to cold, because in young babies actually having low temperature is as kind of serious as having high temperature. So we don't want them to get cold, and that the proper clothing is whatever you're comfortable wearing, and you add just one layer to it. That should not result in overheating the baby, generally speaking. What was the second question?
A cold bath.
Yeah, so usually I would recommend, like cold cloth, that will be safer. I won't recommend cold bath, it will just be kind of sometimes almost shocky to the child. Occasionally, want to make sure you're watching the child, monitoring the child in that bathtub. So generally speaking, cold cloth is good enough, or tepid water if you want to give like a bath to the baby under supervision, that's also reasonable. But my preferred method is to do cold compresses or cold cloth, and that will be good enough.
Jenna wants to know if over-the-counter fever-reducing meds are the best way to treat her 10-year-old who runs a 100-degree fever regularly.
So 100-degree temperature, let me tell you here, is really at the upper limit of normal. And it will be very helpful for me to know if we're talking here about temperature measured. I'm assuming he's like 10 years old, so it's probably oral. So that's really upper limit of normal. And I don't know if that's toward the evening or the morning. And as I mentioned, it could be normal body temperature for him. And if especially he's acting well, I won't worry about it. Now, if you're worried about it, you probably need to keep a log of this temperature and how is your child behaving and acting, or what other symptoms he's complaining of during that time, to really verify if this is really something you need to treat. And you can definitely check with your pediatrician about that. But any medicine of over the counter, either Tylenol or acetaminophen or ibuprofen, which is called sometimes Advil, Motrin, are good to reduce the temperature. And you could use any of these. But your child has, your child, if he's running a concerning temperature, need to be seen to find out why he is having this fever, not only just treat the fever.
Nicole on the Mid-Michigan Now Facebook page is asking, she has a 13-year-old that has fevers, sometimes high grade, at least a few times a week. Her family doctor didn't seem concerned, but after a year, she is concerned.
How old is the child, you mentioned, or do we know that?
Almost 13.
13 years old. So again, we need to know exactly what we mean by the high temperature, how high it is. And what I'll advise here is, again, to keep a log. When is it happening? How often? It's very important for me when I see such a child to know like the interval where the child has no fever. How long do they last? What kind of symptoms he has? Because there are things called cyclic fevers. There are a group of illnesses. We call them periodic fever or cyclic fever. They have different patterns, different kind of symptoms that come with it. Some of them are genetic. So you may want to chart down this temperature and bring it to the attention of your pediatrician, or ask for a referral to see infectious disease specialist to be able to track this fever and see if any testing is needed.
I think this is the last question, and I'm sure a lot of parents have dealt with this. My school says a child should stay home 24 hours after a fever ends. If your child's feeling fine, is that really necessary?
Good question. For most of the time, yes, that is necessary, because many illnesses, like let's say take for example the flu, even the child feeling better, usually they might continue to shed the virus and might be contagious until like 24 to 48 hours after fever resolution. So most public health policies recommend having no fever for 1 or 2 days before return to school to ensure the child is not contagious to other, or still not shedding that virus that can make other kids sick. Despite the child looks good and able to attend the school, it's more of like for the good of everyone.
Okay, thank you so much, Dr. Rafe'e. We hope you know that there are only a handful of hospitals like Hurley Children's Hospital in the state with the level of trauma care, NICU, pediatric emergency, and U of M specialists rounding out the premier team to heal kids and give families hope. You'll always be making the right choice choosing Hurley Children's Hospital. If you want to make an appointment with Dr. Rafe'e, call 810-620-9773 or head over to hurleymc.com. We hope you join us May 25th for Spine Time treatment options for back and neck issues with our new Director of Neurosurgery, Dr. Mark Moisey. He's come to us from the prestigious Detroit Medical Center. Thank you, Mid-Michigan Now, for being a great broadcast partner. Have a great day, everyone.